Now, once we have diagnosed that it happens to be an isolated meniscal lesion, may be associated with on the bucket handle tear, or there may be only anterior posterior horn of the meniscus, of the medial or the lateral meniscus, then we go for the treatment. Initial treatment of all these meniscus injuries is same, that is always the rest. We give them analgesics, anti-inflammatory, and along with the ice fermentation. Why ice fermentation? Because it also decreases pain as well as swelling around the knee joint. Therefore, you need to give them rest, analgesia, and all that. Therefore, they settle down, and once the fusion and swelling of the knee is settled down, they can be go for rehabilitation of the knee joint. Because whatever the surgical treatment needs to be done, that needs to be done once the knee is fully functional. It's actually the muscle mass bulk is normal. There is active flexion and contraction, extension of the knee joint, and the functions and other ligaments of the knee are actually functioning properly. Therefore, treatment of this meniscus lesion can be broadly divided into three types. One is the treatment of the locked knee. That is how to deal with this catching and snapping sensation, which usually occurs in the chronic stage of this disease. One way of doing it is always with the rehabilitation. Muscle strengthening exercises can be done so that once we go for some form of a surgery, the muscle should be strengthened enough and ligaments should be strengthened enough so they can easily overcome the stress of the surgery. Then other option is arthroscopic, either the partial or complete meniscectomy. If there is a small tear in the white zone and it's because of the white zone there is less blood supply, it's not gonna heal, we can go in once we have done the rehabilitation of the portion, or there's new term for this called as prehab, or before the surgery you have a rehabilitation called as prehabilitation. If that has been done, we can go for arthroscopic partial meniscectomy as well. Or if there is a massive tear or complex tear and patient is young, then probably the one option is also to go for arthroscopic complete meniscectomy as well. Another option is suture repair. Now, the one meniscus repair can only be done. That is why the blood supply and the zones of the meniscus are important. Because if the tear is involving the red zone, usually it has a very good blood supply and repair can function properly and patient can get better. In red-white zone, sometimes repair does works, but sometimes it doesn't. And usually in the white zone, there is very little chance of success of a repair in case of you're doing meniscal repair. Now, meniscus repair could be open as well as arthroscopic as well. One option of doing the meniscus repair is actually doing it arthroscopically through inside out or outside in technique, or nowadays all inside meniscus repair is also being done. Meniscectomy, total meniscectomy is sometimes done when you have a complex tear involving patients with old age. Usually in the case of young population, this is all sometimes very difficult to remove all the meniscus, because that will actually increase or accelerate the degeneration at the knee joint. Therefore, one option is to go for total meniscectomy, and meniscus transplant is being actually carried out in certain centers of the world, although it's not have become a norm because of its results have not been as good as expected. But in some cases and in some centers, what they're doing is they're doing the total meniscectomy in the young population, followed up by the meniscus transplant as well. So they've got the meniscus removed because it was beyond repair, and then they have put in a new meniscal transplant from another donor source or a human donor source. Therefore, that is one option, but usually it's not good enough. Sometimes even in young population, you have to go for total meniscectomy because of the kind of a damage it is. And then you have to further enhance the rehabilitation because to decelerate or decrease the speed of degeneration which may occur later on in the knee joint. Other option is arthroscopic meniscectomy. Nowadays, the trend is mainly towards from open meniscectomy towards the arthroscopic meniscectomy, and usually it's arthroscopic partial meniscectomy. Once you're going in, you see what type of tear it is. Is it complex? Is it large enough? It's large enough. You just remove half of the meniscus and leave the half of it. And it's usually the trend is towards preserving meniscus and more towards going for a partial meniscectomy partial arthroscopic meniscectomy of the meniscus, because that also helps to actually conserve meniscus, and actually some more function of the meniscus is also conserved. That is, it reduces hoop stresses. It's actually cause force transmission because of this excess shock absorber. Because of all these factors, the trend nowadays is towards going for partial arthroscopic meniscectomy of the partial meniscectomy of the knee joint, and that is to conserve as much as meniscus as possible.